pregnancy symptoms during week 10. Body changes. The thickening in your midsection is most likely due to slight weight gain and bloating. You're between regular and maternity clothes now, so pants and skirts with stretchy waistbands are must-haves. Here are some maternity fashion hacks to make your traditional clothes fit longer into pregnancy. Excess saliva. You may be salivating more than usual, especially when you're nauseated. It's common and normal to have extra saliva during pregnancy, especially in the first trimester. If you're unable to swallow your saliva, spit it out. Drinking more water, chewing gum, and sucking on hard candy can help you swallow excess saliva more easily. Vaginal discharge. You do not imagine it. You may have a lot more vaginal discharge during pregnancy because of higher estrogen levels. The healthy release is odorless or mild-smelling and milky white. You don't need to do anything about it. But call your healthcare provider if you see a sudden change in the type of discharge. It smells strong or unpleasant, or it's gray, yellow, or green. Newly visible veins. You might notice blue, prominent veins across your chest, breasts, and belly. As your body produces more blood to support your pregnancy, your veins enlarge and are more visible. As your uterus grows, you may also develop varicose veins in your legs and lower body. The good news is, they often disappear or improve after you give birth. Mood swings. You may find yourself experiencing a wide range of intense emotions right now, from joy to sadness. Take comfort in knowing that mood swings are normal during pregnancy. Stress, fatigue, and hormonal changes affect your levels of neurotransmitters. And, of course, there's also the range of feelings you may have about becoming a parent. But if the negative feelings persist, you may be experiencing pregnancy depression. Talk to your healthcare provider and ask for help. Morning sickness. Your nausea and vomiting may be worse than ever. Morning sickness peaks around 9 or 10 weeks of pregnancy for many women. That's when levels of the pregnancy hormone human chorionic gonadotropin are highest. The good news is, your morning sickness may soon start to fade. At 11 weeks, HCG levels begin to fall, and by 15 weeks, they've dropped about 50% from their peak. Many expecting moms get relief from morning sickness early in the second trimester. Dizziness. With 30 to 50% more blood pumping through your veins, your body is working harder than usual. Your nervous and cardiovascular systems mainly adjust to these changes without problems. But occasionally there may not be enough blood flow in your brain, making you feel dizzy or lightheaded. If this happens, sit or lie down immediately and put your head between your knees if possible. If you're driving, immediately pull over and stop the car until you feel better. Baby development at 10 weeks. Your baby's eyes. The main parts of the eye that enable your baby's vision, the cornea, iris, pupil, lens, and retina, are fully formed. Eyelids cover your baby's eyes, which will stay shut until you're 27 weeks pregnant. Early brain development. Your baby's forehead temporarily bulges with its developing brain and sits very high on its head, which measures half the length of its body. Synapses in your baby's spinal cord allow them to move their limbs and fingers. 10 weeks pregnant bellies. At 10 weeks pregnant, you may notice that your belly looks rounder, especially if this is your second pregnancy or you're expecting multiples. It's also normal if you're not showing and see no difference at this point. The size of your bump depends on many things, including your body type. You may have gained a few extra pounds by now. Experts recommend a pregnancy weight gain of 1 to 5 pounds in the first trimester, but some women gain more and some gain less. Thanks for watching. Don't forget to subscribe.